Good evening, Facebook. You have joined us live this evening. We've been joined by the fantastic Neysan from the Roscam Dental practice over in Ireland. So, Neysan, how are you?
Good. Thanks for having me, Stephen.
No, it's a pleasure. Now, tonight we're going to be talking about the very important diagnosis of facial pain. So if you've ever suffered with facial pain or headaches in particular, then this is exactly what you listen to. So this is exactly what you need to be listening to, sorry. And if you've got any questions, you can just leave them in the comments box below. But Neysan, so you're back in clinic now, aren't you, after the lockdown period?
Yes, we've just started this week on a phased-in basically process, and we are currently seeing emergency and urgent care treatments and stuff like that. So it is limited, but we are back and we are able to provide some service to our patients and people who need us. So that is a good, positive outcome out of this.
Yeah, fantastic. Did you get many calls from people whilst you were closed? Because I guess what we're going to be talking about tonight, the headaches and facial pain, they're obviously very traumatic for people that suffer from them. Did you get many? Do you get many presentations of that in the clinic?
We do. Not over even when we were closed, we had our basically virtual or over the phone consultations and services. So yes, we were getting a lot of phone calls, people looking for help in very difficult situations. And thankfully, we were able to help a lot of them, if not all of them. And unfortunately, pain doesn't really care that there is a pandemic going around.
Yeah, it's a bit inconsiderate. It needs to read the news, doesn't it? And look at the headlines. The government are telling it pain should go away in the lockdown.
Absolutely, right? They are a bit inconsiderate that way.
Excellent. So you're just in a course at the moment, aren't you? Are you okay talking about that?
Absolutely, yeah.
Fantastic. Good. It's exciting. So you've got your last exam soon, haven't you? Not to put you under any pressure at all.
It's end of year examinations coming up soon and all of that. It's been an interest and a passion of mine for years, and finally I was able to enroll in a master's program, basically treating a lot of orofacial pain conditions and learning more about them as we're going along.
Yeah.
So it's fantastic, and I had a great mentor that got me into this years before I started my course.
Excellent. So what is the course?
It is on orofacial pain and oral medicine. So basically it deals with a lot of the more uncommon conditions, uncommon pain and discomfort conditions to do with the head and neck area, especially in the orofacial region.
Yeah.
And obviously as part of that course, there is a lot of lesions and pathology that could potentially cause pains and stuff like that that we learn about, and it helps basically draw a conclusion and a diagnosis at the end of it.
Yeah. So you're a dentist by profession, aren't you? And you're constantly doing online. You're constantly doing courses for CPD, aren't you? So that's similar to, so as osteopaths and physios in the business that we have to do a certain number of hours of continued professional development as well. I actually got told off one year for doing too many, and I got investigated. So if you're listening and you're an osteopath, then don't do too many because you get told off. Too many. But what's the most CPD you've done in a year? Do you go over?
I commonly went over. I never really had an issue with basically meeting quotas over the years, and it is a great thing. To be honest, you see it in a lot of works of life nowadays, even in IT, engineering, and all of that. You have to constantly keep on top of things because technology and everything and the science around us is changing all the time. So CPD is a fantastic thing, and to basically get you up to speed with the new developments that's going around. But at the same time, it is a great opportunity for connecting with colleagues and different professionals in other walks of life as well. So CPD has been around for God knows, since probably I graduated from university, and it's just evolved and developed, and here we are. But yeah, once you find an area that you're more interested in, and you can pursue it in other basic, more structured educational programs like a master's program or something like that.
Brilliant, brilliant. So listen, if you listen to us live on Facebook, just comment below to make sure that we can hear you right now, or you can hear us even. We'd love to be able to hear you. So if you've got some questions, then of course just leave them in the comments box below. But tonight we're going to be talking about the common causes of facial pain, the common solutions for facial pain, and what you need to do about it if you have or you know someone that has facial pain. But Neysan, so the nerves on the face, because most pain is carried by nerves, isn't it? So there's probably a good place to start. So where is the real, what's the nerve supply to the face from your point of view in terms of when patients come in and what kind of pain they come in with?
Obviously, no, nerves are basically what connects everything to the brain, and the head and neck are no different. In the head and neck region, we have 12 nerves, which are called the cranial nerves. The main nerve of interest in basically dentistry and a lot of facial pains and stuff like that is the trigeminal nerve. Obviously, other nerves play a massive and a huge part in transmitting pain signals and all of that. But the trigeminal nerve would be one of the more common, and it is, if I'm not mistaken, one of the biggest cranial nerves, and it supplies a huge range, basically, of the orofacial areas, including the teeth, sinuses, part of the skin of our face and the scalp, and basically the forehead and all of that, and around the eyes. So it does cover a whole range of areas in the face. So anything that affects that particular nerve can basically be transmitted to the brain as painful signals, and that's where the pain is perceived in the brain. It's actually, we feel it here, but the brain is actually processing those signals and telling us that it is pain.
Yeah, no, it's really interesting because we see a lot of people in the clinic with facial pain, and trigeminal nerve is obviously the main sensory distribution of the face. But the other considerations that we come across a lot are the C2, well, basically C1, C2, and C3 all have contributions up into the head and the face. But we tend not to deal with people a lot with facial pain, but when they do, it's often because other things either haven't worked or they've tried other things and it hasn't really resolved their problem. So we have, I was telling you earlier, we have a laser that we use for helping people with facial pain, and that's specifically to target the trigeminal nerve on the surface of the skin, which is really important. But what considerations do you have when it comes to treating people with trigeminal? How would someone present with trigeminal neuralgia in terms of facial pain?
Trigeminal neuralgia is one of the more common facial pain conditions that people suffer with. Normally, it's a specific cohort of patients. Typically, they are females above the age of 50, and the symptoms are quite distinctive. They are very excruciating, kind of normally described as stabbing, lancinating, taking your breath away kind of pain that stops you in your tracks when that happens. So it is quite distinctive when patients come in with those types of symptoms. So one of the first things that we think about is trigeminal neuralgia, especially if they fall into that age group and the gender basically category. So we think about trigeminal neuralgia. There are a number of causes for it. It could be sometimes idiopathic. We don't know what caused it, but obviously in the process of making a diagnosis, we have to eliminate any other causes, such as abnormal growths in the brain area, and we use MRIs and CT scans and stuff like that to be able to rule out any sinister causes for this. And then once basically everything is ruled out, you embark on treating those patients. Obviously, a a lot of orofacial pain is multidisciplinary. So the likes of dentists, orofacial pain specialists, and neurologists, a lot of basically disciplines come into managing and diagnosing and treating patients with those kind of conditions.
Yeah, yeah. And some of the common treatments, which we'll go on to later, involve kind of some quite very strong pain medication, don't they? So
yeah,
it's very interesting how they get treated. But what kind of quality of life do these people have that experience this pain? Because the people that we see in clinic, they have everything ranging from like sensitive skin that they can't even smile a lot of the time or make facial expressions, so they kind of like really tense like this and can't speak because any facial movements tend to trigger off the sensory sensory stimulus to the superficial nerve. So that makes it really difficult to live a normal life, doesn't it?
absolutely, absolutely. My heart goes out to those patients, because even normal routines in life, like shaving, putting on makeup, even the cold breeze on a windy day can set off those symptoms. So they can be quite uncomfortable, and it does affect everything that patients do, unfortunately. And that's where we try to help patients reduce, or if possible, eliminate those symptoms where possible.
Yeah, yeah, it's very different. So I guess that must be why you're. Is that why you have a particular interest in it? Because it's very difficult to manage condition and it improves quality of life.
Absolutely. Obviously, trigeminal neuralgia is one of the conditions. There are so many other conditions that kind of fall into that category, the neuropathic pain category.
It sounds like you're itching to tell us about all these other conditions. If it's not trigeminal neuralgia, what else could it be, Neysan?
Obviously, pain in general, in the head and neck. Pain from a physiological point of view, pain is normally good. It's basically your body's way of telling your brain that there is something wrong. It is a protective thing. So if you put, for example, your finger on a hot stove, the signals get to the brain and you remove your hand from that. Pain becomes an issue when it's the system stops stops functioning within its normal capacity, and it is perceiving normal sensations as pain, such as the trigeminal neuralgia, for example. So generally, pain is quite common. One of the most common orofacial pain conditions is a general toothache, for example. Toothache is a pain condition, and that's where basically us as dentists come in to try and find the root of the problem and treat it. But beyond that, a lot of other causes can cause or start the pain. For example, there is muscular issues, there is neurological issues where the nerves are not functioning in their normal capacity. The muscles can go into spasm and start causing pain in the affected area, or referring pain, causing, for example, headaches, jaw pains, and stuff like that.
Yeah.
And then go in the likes of jaw issues as well. So jaw pain, jaw joint pain, and stuff like that. So there is a wide range of painful conditions that can cause uncomfortable sensations to patients. And that's where we try to come in and basically put our finger on the actual cause of the pain and try to treat it that way. So understanding what is causing the pain is the first step in trying to treat it. At the same time, sometimes, unfortunately, because the nerves are so interconnected, certain conditions can deposit as normal tooth pain. For example, there are certain headache conditions that could deposit in the facial area. And normally when you think of a headache, you think about pain in the head, but sometimes that headache, like certain migraines, for example, can be felt in the facial area, and it could mimic conditions like tooth abscesses, infections, and stuff like that. Sinusitis, for example, as I mentioned earlier, the sinuses are supplied by the trigeminal nerve, and so are the teeth. So for want of a better word, wires can get crossed sometimes, and you could feel a sinusitis pain as toothache, or vice versa as well. And so there's a whole range of painful conditions that people could suffer with, and we try to basically address those issues as we come across them.
Yeah, I think one of the most tragic stories that I've seen in clinic has been a lady that came in presenting with trigeminal neuralgia, and actually before they'd diagnosed it as trigeminal neuralgia, they'd taken out all of her teeth on one side of her face to try and alleviate it, and it hadn't, because it was literally just the nerve. So it's, I think it's really important that people are aware of these multifactorial conditions, and also where the wires can get crossed that could be mimicking something. Another lady with sinus problems, and that was trigeminal neuralgia. So it's lady with other way around. So she'd been diagnosed with trigeminal neuralgia, and it turned out it was a sinus problem. So with her, we took her off wheat and dairy and looked at reducing her mucus production, as well as giving us some exercises to help improve the sinus drainage and some breathing exercises as well. Pretty much nothing else had worked with her, and she did get some change with that. Didn't completely go, but it did dramatically help as well. So we actually sent her to a specialist dentist who did some drainage of the sinuses, which cleared up the problem completely. So that was brilliant. But she only found it, I think they did an X-ray or a scan of her, and they found fluid level in her sinuses. So there's quite a lot of fluid in there. So the pressure must have been quite immense.
Absolutely. It's it is. It can happen sometimes, as I said, where the wires get crossed, and it directly mimics a toothache problem. And obviously, when you treat the tooth and the pain doesn't go away, you start thinking, okay, what else could be going on here? And you have to start looking outside the box. As I said, it is a process. It's not. It's oftentimes it can be frustrating for the clinician and the patient, basically, because it is sometimes a process of elimination. You're eliminating different causes that could be leading to the painful condition that the patient has, and you have to start with the teeth, for example, go to the sinuses. Obviously, as a dentist, I wouldn't be diagnosing kind of sinus issues. That's where our ENT colleagues come in, and our neurologists come in for basically taking different scans and all of that, and eliminating any further pathology closer to the brain and stuff like that. So it is a very, very multidisciplinary area where basically everybody, different professionals are involved in diagnosing and managing and treating those conditions.
Yeah. No, it's really interesting. Thanks for sharing that. So once you've diagnosed where it's coming from, what choices of treatment do you have in terms of dealing with facial pain?
Again, it goes back to what is the root cause of the problem. For example, staying on the topic of nerve issues like the trigeminal neuralgia or different neuropathies of the face. Sometimes it's a lot of the time it's actually medications, basically trying to basically modulate those nerve impulses and stuff like that. And there are different types of treatments nowadays, kind of counter stimulation, like what's it called? The name escapes me now, but like I'm putting electrical signals to kind of mask or block the painful signals that go up. It's the name escapes me, but anyways, there's the medications. There are certain types of nerve blocks that are used as well to control the pain. There are nowadays there is some evidence coming out that certain Botox injections can help as well and stuff like that. But obviously, all of these are done with people who have a lot of training in those areas, and they are managing those patients on a regular basis. So there's a wide range of treatments, and oftentimes a treatment that might work for patient A might not work for patient B, and vice versa. So sometimes you have to try one or two different medications or different treatment types until you find the one that works for that particular patient. because we're all made differently and we respond differently to different treatment modalities.
Yeah, no, it's very interesting. Very interesting. So, do you get many people coming into, because you're a dentist at the moment, but you're going to specialize in facial pain, but do you have many people that come in at the moment that you diagnose as having a particular cause of facial pain, or we think they have a diagnosis of a particular cause of facial pain, and you have to refer them on? So where do these people go to get their facial pain treated?
Absolutely, yeah. In our clinic, we do see patients. Obviously, one of the most common painful conditions that we see is jaw problems. So jaw problems are common. Thankfully, the nerve or neuropathy, neuralgia problems are a little bit less common. But we do get patients, unfortunately, with those conditions. And yes, we liaise with a lot of our colleagues, basically, to eliminate other causes and all of that. And then once the correct diagnosis is made, then we start on a course of treatment for those patients and try to manage their conditions.
Yeah, no, fantastic. It's good. Good. So, Neysan, we normally leave people with a few tips at the end of the session, don't we? So,
yes,
what I want to do tonight is slightly different. So, I was going to ask you, so what are the 3 most common conditions that present with facial pain? And then what would your 3 tips be for those conditions?
Okay, I think the first tip that I can give, one of the predisposing factors, obviously genetics plays a huge part in who gets certain types of facial pain and stuff like that. So, for example, if we talk about a trauma, I might get hit in the face and I might develop facial pain, kind of chronic facial pain, but patient X, who has exactly the same age, same gender and all of that, and might not develop it after the exact same trauma. So we understand that genetics plays a huge part. But in general, it is recommended to treat infections as soon as they happen, because chronic infection has been proven to be one of the predisposing factors for prolonged chronic pain. So as a dentist, first and foremost, I am a dentist, and chronic infection is something that I suggest to all of my patients to treat as soon as possible. So don't let problems linger on. Sometimes when you get a toothache, for example, and the antibiotic fixes it, and it kind of you forget about it. It's out of mind, out of sight kind of thing, and then you ignore it until the next time the pain comes. That's the first tip I would give to patients. As soon as there is an issue or a dental infection, address it as soon as possible. It significantly reduces the chances of things developing further. And the second thing is, I think the second tip I would give is, yes, certain painful conditions mimic dental pains and stuff like that, and going to the correct professionals to basically address those issues. And when those issues aren't addressed, I am sure that a lot of dental colleagues would be basically asking for second opinions, for example. Second opinions are really, really good, and sometimes something doesn't fit right, and then you start looking into it a little bit more and you realize that maybe that the dental pain that the patient presented with initially wasn't what actually a dental pain. Maybe there is something else going on. So always basically look outside the box. That would be my second tip for patients and colleagues.
Great. And then last tip?
Off the top of my head, I can't think of anything, but as soon as there is an issue, don't ignore it. Try to address it and all of that. One of the things that obviously nowadays we get, I've had a few phone calls about this, is stressful situations, and all of us are sitting at computers and all of that all day long. So neck problems are very, very common, and in the process, jaw pains are starting as well, because a lot of people are clenching their teeth and grinding their teeth and all of that. So if you are having any of those issues, try to address them as soon as possible, because again, chronic pain is not really good to be left untreated. So address those issues. And sometimes there are very, very simple ways of dealing with those situations. For example, if you have a painful neck, our physio colleagues can really address those issues and give you the exercises that would make a huge difference to your life. So address those issues as soon as possible. And if there are obviously any jaw and tooth issues, get them looked after.
Brilliant, brilliant. So Neysan, you're joining us next week again, aren't you? Hopefully.
We will try our best. We will try our best.
You're a busy man soon, aren't you? Because you've got your last exam. When is your last exam?
This set of exams are sometime in the middle of July. I can't think of the date, but another month to go.
You can tell us about one of the modules that you've been studying about next week then.
We can.
Yeah, good, it'd be interesting. Good. Well, listen, thank you very much for joining us. If you've been listening live on Facebook, this has been the Perfect Balance Clinic Power Hour, and we've been joined by Neysan Shah from the Roscan Dental Institute in Ireland. So thank you very much for joining us, Neysan. It's been great talking.
Thank you for having me, Stephen. Thank you.
Great. And if you've got any questions, then just leave them in the comments box below. But next week, we'll be talking about more dental-related conditions, because I think it's a very underserviced area when it comes to patient education. So I think we can dramatically improve our health just by knowing a little bit more, and that's the gap that we're trying to fill at Perfect Balance. So we'd love to have you back on the show next week, Neysan. And if you're watching live, and if you're not watching live, then you should be, and join us next week in the Perfect Balance Clinic Power Hour. But for now, it's bye-bye from me.
Bye for me.
And bye from Neysan. We'll see you next week. Take care, guys. Bye-bye.
Yes, bye.